Allied are committed to delivering high-quality solutions tailored to meet the diverse needs of our customers. Our product lines are designed with innovation, functionality, and reliability at their core. Introducing the future of molecular diagnostics. Palm-sized, powerful, and rapid. PlusLife MiniDoc, the next-generation palm-sized rapid molecular test. A revolutionary leap in diagnostic technology. Designed for portability and speed without compromising accuracy. This compact device brings lab-grade testing capabilities to your fingertips. Whether you're in a clinic, the field, or a remote location, our PlusLife MiniDoc empowers professionals and individuals alike with instant, reliable results, anytime, anywhere. Available and emerging test menu. Pandemic pathogens like COVID, tuberculosis, monkeypox. Respiratory panels. Combination of COVID, Flu A and Flu B, RSV, Flu A and Flu B, Strep A, Strep pneumoniae. Sexual transmitted disease and newborn's health. Single cartridge for chlamydia, Neisseria, ureaplasma. HPV 1618. Group B streptococcus. Imported and distributed by Allied Hospital Supply International Corporation.
Vexillium POCT CLIA. Accurate, convenient, consistent, rapid, and economical. Introducing our Vexillium Chemiluminescence Immunoassay Analyzer. Calibrator and controls are included per box of reagents that can save cost for Cal and QC. Cartridge type for all immunoassays. Disposable sampling tip and multiple magnetic separation, avoiding carryover interference. Complete tests for cardiac marker, inflammation, fertility, thyroid, bone metabolism, tumor markers, infectious anemia, brain injury, allergy and autoimmune disease and diabetes. Suitable for hospitals, emergency and ICU, clinics and laboratories. Vexillium POCT, Chemiluminescence Immunoassay Analyzer. Distributed by Allied Hospital Supply International Corporation. Keep exploring as we yearn for the unknown. Pursue the ultimate as we reverence for life. The Vexillium Automated Urine Analysis Assembly by Allied Hospital Supply. With innovative modular design, processing 4 prominent characters, fast speed, high precision, comprehensive projects, and humanized design. The assembly line is composed of dry chemistry module, formed element module, sample catching and recovery modules. With 1+2 modes, the detection speed can be up to 360 samples per hour. Dry chemistry detection. The minimum sample size is as low as 1.5 ml. The sample dropping accuracy is as high as 0.2 microliter. The ability of resisting VC and color interference is excellent. The dry chemistry module is equipped with patented technology integrating 5 physical and chemical detection indicators. Formed element detection. The sample can be enveloped after the sheath flow pool. Which makes sure the formed elements pass through the image acquisition area in the form of monolayer cells. Without accumulation and overlap. 400 times optical microimaging, combined with high-speed imaging technology, can take 2,000 pictures with 1.5 million pixel in 10 seconds. The flow cytometry technology and apochromatism microscopy high-speed imaging technology perfectly integrates high sampling volume with high-definition image acquisition. AI identification technology, CNN, uses big data and AI artificial intelligence algorithm to automatically and precisely recognize and classify all captured formed elements, realizing the excellent detection rate and recognition rate. The dry chemistry module provides 14 dry chemistry analysis, 5 physical and chemical items, including quantitative AC detection, which provided more accurate diagnostic basis for kidney diseases. Formed element module can perform 28 formed element detection and 5 clinical prompt functions, which are RBC source, RBC histogram, urine culture, urinary tract infection, and microscopic view. In morphological analysis, the detailed classification of red blood cells and tubular types is beneficial for the location of the renal lesions, which provides diagnostic basis for the course of kidney diseases. The combined interpretation of dry chemistry and morphology provides more comprehensive detection methods and judgment basis for the diagnosis of kidney and urinary diseases. One-click operation and fully automatic detection. Truly unattended operation. Up to 600 sample locations can be expanded. Sample information can be automatically identified, and the whole process can be traced. It is equipped with an emergency position. Samples can be tested at any time. Non-stop reagents loading and remote cloud service function can be realized. Decipher the micro world. Reveal the human mysteries. See the truth in the details. Fixilium Urine Sediment Analyzer. Medical technologies powering a healthy future. By Allied Hospital Supply International Corporation.
Carbon-13 Urea Breath Test, HCBT-01. Welcome to use Headway's Urea Breath Test System, which is an advanced diagnostic tool to detect Helicobacter pylori. The test is accurate, non-invasive, and rapid. This is how it works. Preparation of test device and kit. Breath test analyzer. Computer. Printer. Carbon-13 Urea Capsule Breath Test Kit. Drinking water. Sample collection. The test should be done on empty stomach or 2 hours after eating. Write down subject's information on 2 breath bags respectively. Remove the cap of blue baseline breath bag. The subject keeps normal breathing and then hold breath for 5 to 10 seconds. Exhale the first half of air and then blow the latter part into the blue baseline breath bag and fasten the cap. The subject takes 1 carbon-13 urea capsule with 80 to 100 milliliter drinking water and then sit still for 30 minutes. Collect the post-dose breath with pink sample bag by following the procedures as baseline breath. Sample testing. Take out the baseline and post-dose breath samples of subjects and connect the samples to the appropriate ports. When they are delivered correctly, both the port indicator and the status indicator on interface of operation software will be illuminated. Repeat the operation above and connect other samples to the remaining ports in turn. Maximum 6 groups of samples can be inserted each time. Tick target sample on operation software. When the port is selected, the select box will show symbol tick. Fill in the information of subjects of corresponding samples. Click Start button to test selected samples in turns. Test results will be automatically saved when test completes. Print the test report.
The B&E and Allied partnership for improving the quality of respiratory medicine by introducing the iCheck Handheld ABG Analyzer. The iCheck Handheld ABG Analyzer has 22 parameters with innovative touchscreen interface and 1-minute sample testing. An easy-to-use and user-friendly handheld ABG Analyzer makes the iCheck stand out from the other ABG in the market. Is your current ABG analyzer enough from what you are paying for? Don't settle for expensive and incomplete ABG analyzer. Got a better solution for latest and cost-efficient technology? Allied Hospital Supply International Corporation got a solution for that. Introducing the B&E eCheck handheld ABG analyzer, the latest addition to Allied portfolio of cost-effective solutions. The iCheck handheld ABG analyzer has 22 parameters with innovative touchscreen interface and 1-minute sample testing. Choose Allied's B&E iCheck handheld ABG analyzer, your partner in respiratory medicine.
Future of rapid diagnostics. POCT Dry Chemistry, a compact, efficient and reagent-free solution designed for real-time Decison making at the point of care. Our ADT POCT Dry Chemistry with new reagent rotor, circular sector type, integrated with diluent. Compatible to various samples, whole blood, capillary blood, serum and plasma. Small sample required of 60 to 100 UL. Maximum 3 tests at a time. Run flexible tests from an individual parameter or a combination. Advanced microfluidics technology, lyophilization and automated process make test results accurate and reliable. Real-time QC system to check quality control on every run. Rapid result within 9 to 12 minutes. Broad test menu suits a wide range of clinical needs.
creatinine meter operation guide. 1. Preparation. Install batteries. Access setup menu. Set date and time using up and down buttons to enter the correct dates and time. Confirm your selection by pressing the power key. Code chip calibration. Insert the code chip and the test strip with the logo side up, exposing the sample inlet. Confirm that the displayed code on the meter matches the code both on the test strip packaging and the code chip. Remove the code chip after verification. 4. Sample collection preparation. Remove the cap of the lancing device. Install the blood collection needle. Twist off the protective cap of the needle. Set aside. Recap the lancing device. Set the desired penetration depth by adjusting the depth control dial. Extend the handle outward. Clean your hands with alcohol wipes and let them dry. Conduct a test. Press the lancing device against the selected sample collection site. Press the launch button. Wipe away the first drop of blood. Gently press the punctured fingertip. Avoid excessive pressure. Bring the end of the test strip into contact with the second blood droplet and load the strip till it fills up the entire reaction zone. The meter will display the result after a countdown. Repeat the same procedure for blood glucose and blood uric acid tests. 6. Clean up after the test. Eject the used strip by sliding the ejection button downward. Remove the cap of the lancing device. Insert the used needle back in the needle cap. Press the ejection button to dislodge the used needle. Follow appropriate waste guidelines to dispose of used materials.
Is the only company with point-of-care diagnostic solutions along the entire HIV cascade of care. Explore our HIV POC solutions. Our HIV diagnostic solutions enable life-saving decisions to be made that have a powerful impact on people, government, and society. The Determine TB LAM antigen test empowers you to diagnose active tuberculosis in HIV patients, providing results in just minutes. The first and only rapid urine-based test for the early diagnosis of TB in HIV patients with WHO certifications and DOH guidelines. Determine HIV Early Detect. The first and only WHO 4th generation's HIV rapid test kits. New possibilities in patient care by closing the window period and detection as early as 12 days of infection. Just add 50 UL of serum, plasma, or whole blood. The MPEMA analyzer brings HIV viral load testing to a wide range of decentralized settings. Quantify both HIV-1 and HIV-2 in just 70 minutes with less sample volume. Our rapid CD4 test helps caregivers establish a baseline immune function and assess clinical outcome, expedite treatment and management decisions, generates absolute CD count, comparable precision and accuracy, flexible small amount of blood using finger stick or venous whole blood samples, compact and portable. In response to this plight, we have developed BioLine HIV Syphilis Duo, a point-of-care diagnostic test, which simultaneously tests for syphilis and HIV in one pass, with only a single drop of blood. Join the path to elimination by maximizing PMTCT program. This time-saving, cost-effective solution is an important component to any PMTCT program. The world's most sensitive rapid diagnostic test for detection of hepatitis B, surface antigen using serum, plasma, and whole blood, with an analytical sensitivity of 0.1 IU/mL, and can detect major vaccine escape mutants. Know if it's COVID-19 or influenza, so you can act with confidence. Timely, accurate testing is the first step toward protecting patients facing COVID-19 and influenza, especially high-risk patients. So act quickly with one test for timely differential diagnosis. Simultaneous detection of dengue antigen and antibody. Cover all clinical stages from acute phase to convalescence phase of infection. Fast test result, 15 to 20 minutes. BioLine malaria. Rapid test kits distinguish PF infection from other species, PV, PM or PO. Useful in regions where all malaria species are circulating. WHO pre-qualified. Clearview fecal occult blood. Accuracy of the test is not affected by the diet of the patients. Result in just 5 minutes with simple procedure. Post-sample preparation, minimal training required. BioLine Salmonella. Type-E IgG IgM Fast is a solid-phase immunochromatographic assay for the rapid, qualitative, and differential detection of IgG and IgM antibodies to Salmonella type-E. Purimeter 720, urine chemistry analyzer, high capacity, maximum 720 tests per hour. BioLine Syphilis 3.0 test is for the qualitative detection of antibodies of all isotypes, IgG, IgM, IgA, against Treponema pallidum. BioLine Chlamydia is for qualitative detection of chlamydia antigen, directly from endocurvical swab and cytology brush specimens. BioLine HCV test is a test for the qualitative detection of antibodies specific to HCV in human serum, plasma, or whole blood. BioLine Have IgG IgM rapid test is for the rapid qualitative and differential detection of IgG and IgM antibodies to hepatitis A in human serum or plasma. The BioLine Leptospira antibody test is a rapid, qualitative, and differential test for the detection of antibodies, IgM or IgG, to Leptospira interrogans in human serum, plasma, whole blood. The BioLine Filariasis is an in vitro, visually read, immunochromatographic test for the qualitative detection of circulating filarial antigen from Wuchereria bancrofti. BioLine Cholera antigen is for qualitative detection of Vibrio cholera in human fecal specimens. Easy to use, convenient, and clean test. The complete solutions for rapid test kits from Abbott RMDx and distributed by Allied Hospital Supply International Corporation.